Welcome to our newest episode of the Lebanese Physicians Podcast. And today our topic will be related to a startup in Lebanon, which is performing genetic and genomic testing on people and is seeking to actually innovate and move genetic testing forward in the country. And our guest today is Dr. Kevin Saliba and Dr. MohammadAli Jardali, who all of you know by this time. He's been a guest on multiple podcasts. So thank you, Dr. Saliba, for joining us. I'm just going to give a brief introduction about Kevin. I can go a lot about Kevin, but I'm going to try to summarize it for the sake of time. So Kevin actually graduated from the Lebanese University and has finished his general surgery diploma there. And that was not enough for him. He was always interested in innovations and innovative surgeries. And also he's been interested in medicine in low socioeconomic status countries and in trying to innovate and help promote medical practice in these countries. And he's published on that quite a bit so far. And he's currently doing his master's in genomics and health at the Lebanese University. And throughout all this, he has decided to have a startup in Lebanon called Genes Arabia that we will be discussing more about today. And he's also involved in multiple local and international NGOs and currently is involved in an NGO in Lebanon that has performed hundreds of cataract surgeries for free in the country. So welcome, Kevin, and welcome, MohammadAli.
Thank you, Khalil, for this introduction, and thank you, MohammadAli. It's a pleasure and honor to be tonight with you on this podcast, and hopefully it's going to be informative and help a lot of people tonight.
Yeah, and I'm excited to be back, and we're excited to have you. It's cool to have someone staying in Lebanon for a change and someone who actually has a startup in healthcare. We don't have a lot of people like that. So it's good to give you this podcast as a platform to talk about your work.
Thank you. It's my pleasure.
So Kevin, how did you get involved in genomics?
In genomics. Yeah, coming from a surgical background and into genomics, this is more like hard science rather than being practical. But actually, it's a personal story, and I like to share with you. This goes back to 2019. At that time, my father had a dilated cardiomyopathy. It was something that affected all of our family severely. And then I started to be curious. My grandfather died early at a younger age. We didn't know why, sudden cardiac arrest. My father had dilated cardiomyopathy, so I was curious, and I went and I did my own profile, my own genetic profile. And I learned a lot about this. And I said, you know what, this is going to be one of the mission, because prevention is very important, and the most important part of doing prevention on a medical level is to go into genomics. This is going to be the future. It's going to be something that would change people's lives and change my life. And from there on, it's one of my missions today.
Very interesting journey. Thank you for sharing your story with us.
Thank you.
So I'm going to dive right into it. And if you can tell us more about genomics versus genetic sequencing, just to hash out the terminology for the audience.
Okay, so we all our cells are made of genetic material. They contain the same genetic information. Our all genomes are written with the four letters, the A, T, C, and G. So if we want to take this and put it like a book, okay, so we have the alphabet, the A, T, C, and G. The genes are like one page of the book, and the genome is the whole book. So if we're doing genetic testing, we're seeing one page, we're seeing one small area that we're looking at. But if we look at the genomics, we're looking at the big picture. So genomics is more like, if you want to put it into like something we see every day, it's like a mechanical watch, and all the parts, how they interact together, they're going to give you time. So if the one part, which is not doing its right function is going to give wrong time. And if one part of the genome is not functioning well, it's not regulating well, it's not coding for a certain protein well, there's going to be some disturbance. But it's much more than that. So the genome by itself, it's like half of the function of the body. How you interact this genome with your environment, with what you eat, with what you take, with what you perform as sports, with what drug you take, this makes this whole interaction, the epigenetics, the environment, defines really what you are. It's not only your genetic profile or genomic profile that defines, but how it interacts with the environment that defines how your health is going to be. So knowing your weakest point, knowing your weakest gene, and doing this interaction with the environment, with what you eat, with what supplement you take, this is going to make a big difference in your health. This is what's going to make you healthier, live a healthier life, live longer, healthy life.
And this is a pretty new technology, right? The human genome sequencing was only done in like 2003, I think. So this is like relatively new technology, and now you're able to do it relatively fast and cheap.
Yes, the first human genome took like 13 years, $5 billion to make, you know, but now in like 4 weeks, couple of hundreds of dollars, you have this, and this is like life-changing technology, really. And what made it available, it's the performance of the sequencer, or what we call the next generation sequencer. So now we have the third, and soon is going to be the fourth generation of sequencer. And with this generation, you know, we're able to sequence a whole genome in like few days. In few days.
So it sounds pretty cool. But what are the clinical implications besides knowing your own genome sequencing?
So the clinical implications are actually quite big. You know, there is a lot of prevention we can do. Maybe on the 3 levels of prevention: primary, secondary, and tertiary. So to put it on a primary level, which means we don't get to the point that we have a disease. So there is a lot that we can know. That's I'm going to give you examples. So let's say on a cardiovascular level, if you have like Brugada or long QT syndrome, which cause sudden cardiac arrest and sudden death, if you have this certain disease, it's very easy. You're going to implant an ICD, and you can have your life completely normal without the fear of like having a sudden cardiac arrest and die. Also, like if you have certain predisposition to disease, say diabetes, say hypertension, say cancer, you're gonna know exactly how to interact with your body, what to eat, what not to eat, what supplementation, what maybe drugs you have to take to prevent. On the second level, on the secondary prevention level, you know how focused you're gonna be. So let's say somebody has breast cancer genes, or colon cancer, you know, let's start screening early on, you know, let's not wait till to the recommended age. Let's be more focused on that. And on the tertiary level, you're gonna know exactly, especially with pharmacogenomics, which is the study that study how your body interacts with the drugs. So you're gonna know exactly how to prevent secondary effect, which molecule is best for you. I'm going to give an example. So one of my patient, I know exactly which anti-cholesterol to give, which statin to give, you know. So in his profile, there is like atorvastatin, annex, simvastatin, annex, rosuvastatin, a green tick. So I start with rosuvastatin because it is the best treatment for his condition. So on the cancer, you know, with the cancer, you can know which type of chemotherapy it works best, which type of chemotherapy it has resistance on. So you can prevent a lot of secondary effects, and you can be very specific, very proactive, and very preventive with genomics. So it has a lot to do with prevention. The basic pillar of genomics is prevention.
So my next question for you is, yeah, prevention is important, but when patients or people come to you to do the testing, do you talk to them about the pros and cons of doing the testing, such as like if you are found to be predisposed, let's say, to Huntington's disease or other diseases that could, let's say, cause blindness or other implications, people may get anxious from that. So are people ready for this if that is to happen?
Yes, this is an very important question. Actually, before doing the test, we do a long history taking an interview with the patient to assess really the patient. And sometimes if we assess somebody that is not ready, we ask our in-house psychologist to have a meeting with him to assess further, to make sure he's ready. Then we ask every patient that his consent to ask him what would like to know. Is there like a certain family history, something like you're really interested to know, or just general knowledge? You'd like to know everything. You'd like to know something that you can make a step about it. And of course, if we see that there is something that may be emergent or a life emergency, usually we tend to tell them. So it's very important to assess them on this level, and we do an approach. So if you have certain means, this is a predisposition. It's not a death note, So there is something we can do, and if there is something we can do right now, maybe with the future studies that we're going. Basically, there'll be something we can do. There's something we can prevent. But at least he has the knowledge, so it's not like a surprise, especially if he likes to know. So fortunately, we didn't have anybody with Huntington disease so far. This is something would be quite challenging for us. But most of the predisposition that we talk about, usually there is steps we can do to reduce the risk. Steps to push further the disease, like have let's say diabetes, instead of having it at 40, let's have it at 50, 60 or 70. We're going to prevent a lot of disabilities. We're going to have better life quality. So this is what we focus on.
So talking about prevention, this is like music to my ear. This is like my bread and butter as family physicians. So I'm glad to hear that there's an extra tool that we can use. So it's good to hear that you sit down with the patient before the results, but do you also sit down with them when the results come back? Do you offer like genetic counseling as part of your service?
Yes, of course. There is a lot of gene testing direct to consumer nowadays that you just send it by mail and you receive it by email. You're going to receive the results. But the core of this is the healthcare professional, because if you read like 400 pages of genomics, you're going to be, oh, wow, this is so overwhelming. Where do I start? But if you have somebody who's trained, who have spent time, who has the knowledge, who know what to tell you and where to guide you, and how to guide you through it, it's going to be much different, but it's going to be a pleasant journey, a journey of prevention. So of course, our core service is not just only doing the service, it's what comes after, the follow-up. So what we provide our client with is 1 month, 6 months, and 1 year follow-up included in every sequencing, and after that, it's just for him either to follow with us or with his primary care physician or any physician who would like. So what we also have done is we have created a network of healthcare professionals, each in his specialty, in order to give further information or further prevention. So if, let's say, I have a certain tumor predisposition, so he's gonna go to our oncologist. Let's say he wants to have, sometimes we have certain athletes, so they want somebody who specializes in nutrition and sports, so we're gonna send them there, and so on and so on. So to each category of disease, to each system of disease or predisposition, we have a certain specialist that our clients or customers or patient could follow up with.
I have two questions for you, actually. One is, are people in Lebanon accepting? How did they accept, or how are they taking this genomic testing? Like, do they find it socially acceptable? Are they open to getting it done? Because it could have clinical implications or implications on their families too. And the second part of the question is, medical insurance in Lebanon, especially these days, has been pretty challenging, and they always deny, let's say, insurance coverage for pre-existing conditions. So if you are found to have a pre-existing propensity to develop a certain disease, will they deny you medical insurance in that case?
Okay, actually, great questions. So answering your first question, actually, we see a lot of openness. Most of our clients or patients are usually open to that. They wanna have a good quality of life. They want to have prevention. The way we approach the subjects also, like make them more comfortable and being at ease with anything that may come up. And it's always up to them to what extent they want to know. So I always have their consent. So this is for the first part of the question. For the second part of the question, and due to the lack of legislation to these conditions, we have added several layers of data privacy to that. So from the anonymity of the test, so it's only a serial number, gonna go with a serial number. You only have access to it and your doctor. It doesn't link to your personal data. Neither your name, neither your DOB, nothing of your privacy data is linked to these tests. Also, you're in control of your genomic data, so you can delete it from our database at any time you'd like. You can have it on a flash drive whenever you want it, so you can download, keep it in a safe place. And of course, it's GDPR, which is the highest norm of privacy, of data privacy compliance. So all the data is safe with us. We don't provide or sell any data, and it's always anonymous, of course.
So maybe this is one of the good things about having a fragmented healthcare system in Lebanon, is that you don't share the data with the insurance. So maybe something good came out of our situation.
No, it's not only that, it's worldwide. So even if you are in any Arab country or any European country, your data, you are in control of your data. So we make sure that this data is very private, nobody has access to it, and it doesn't link to your private data.
Okay, so I wanted to ask you questions on the business side. There's like a ton of challenges starting a business right now in Lebanon. So do you want to share maybe more about your experience operating in the current climate?
Like for every crisis, there is new opportunities. Maybe I'm going to start with the opportunities, I like to see things from positive side of the spectrum. So maybe this is the right time for us to start, because the big names, the big competition, the big companies are really downsizing, closing. So there is a market, there is people who need this. It's not, part of what we do is prevention, but a big part of, or big chunk of what we do is also diagnostics. So people who need this, people who are in need of genetic testing and genomic testing, people who have cancer and need to know which type of therapies, targeted therapies they need to do. People who have unknown syndromes and they need their kids, or they need to be diagnosed. So this is one big chunk of our part of what we do, and we provide diagnostic, we provide something very essential for people to recover. And today, what we have done, we calibrate the market. We've seen we made our profits, our margins very small, just to sustain the business. But the most important thing is to provide the service to the Lebanese citizens and to the Lebanese population. It's very important for us. This is a very technological tool, which is important nowadays. We cannot skip it. We cannot be like in the 70s anymore. We need to be to have the best therapies for us, and we need to have these diagnostics. So part of our responsibility is to provide these tests to the Lebanese population, to the Lebanese citizen. And that was an opportunity. So we're doing this, we're providing the service, we're doing, we're a startup, and it's doing well, you know, even with all the challenges, even because it's all paid in fresh currency, because our lab is in Italy. So you cannot make one big lab in Lebanon like the one we have in Italy. It wouldn't make sense. And if you're gonna price a test, it's gonna be like 10, 15, 20 times costier than what it is. Because to run such a facility, it has a huge operation, and because our lab work all over the world, so this makes more affordable for people to do it.
So basically, what happens is you draw, or the blood or the samples are drawn in Lebanon, but then they're sent to Italy to be run over there, right?
Yes.
So basically, the lab is operated by. So you were able to sign an understanding or an agreement with the lab in Italy to run these samples for the patients, right?
Yes, actually, we started in 2 countries. We started in Lebanon, and we have operation in Jordan. And what we're looking for is to expand also in the GCC. We consider Lebanon as our primary market. It's always the market to start with, to provide the service, and also on a business level, it's also a market to learn and interact with, because unfortunately, but there is a quite margin for learning, you know. So you can learn a lot, you can interact a lot. You can take there is a lot of competition here, and there is a lot of but also at the same time there is a lot of flexibility. So you get to learn, you get to understand. It's always a hub for all the startups of the Lebanese, and if you can make it in Lebanon, you can make it anywhere in the world, you know, with all these challenges that we have, with all that step backs that you have. So if you can make it here, I think you can make it anywhere.
So basically, I think Dr. Jardali's question was it easy to start the business? Like how, because you have to go through a lot of bureaucratic red tape, right, to get to start the business and move it forward.
Yes, there is a little bit of hard work, especially, well, that's bad for our lawyer. She has to take care of all that. But on the bright side, it's you know, it's all about your drive. It's all about your ambition. It's all about your ability. It's all about how hard you want to make it. You know, if you want to succeed, you can succeed. This is something very essential. Second thing is always to get your team, to have a good team, to be surrounded by a good team, to have good strategists, good business developers, good prospectors, and you have to reach out to every person you know. You know, if we say, let's say we're segmenting our customer, we don't only reach to pediatric neurologists, oncologists, cardiovascular, cardiologists, we reach to everybody, you know. Everybody can give you like a piece of information you didn't know about. Every person you talk to will give you like a new horizon you didn't know about, you didn't think about. So reach to everybody, tell your idea to everybody, and it works.
I like the positivity. I like the attitude, and I hope it gets you far. I wanted to ask you, like, how big is your scale of operations right now? How many patients are you able to reach, and what's like your target?
Okay, so basically now we're expanding because of two university hospitals. So we're going to be providing them with all their genomics and genetic services. This is one part to our business model and logistics facilities that we provide. So we provide a lot of facilities, especially logistic-wise, shipping, handling is one part of what we do. Second is the genetic counseling services. So a lot of doctors and a lot of hospitals, they have one big problem, which, okay, with the sequencing, with the genetic study, but who's there for us to read it? Today we were in a visit for one of the doctors and told me, okay, we did this whole genome like 2 years ago, and till the day we don't have an answer. So I told them, just send us this, and in like 1 week we're gonna give you the result. So you're gonna know exactly what was it. So this part of the service is what usually make people do business with us, providing providing the reporting, providing the expertise to read such genetic information and such genomic information.
That's good to hear. And did you want to share a little bit about your corporate social responsibility? We were talking about it before we filmed this.
Yes, of course. So also one part of what we're doing, we were approached by one of the governmental hospitals and one of the NGOs that take care of a lot of neonatal patients, basically newborns, kids who are left. So they take care medically of them before sending them to another NGOs or facilities that take care of them. And most of the time, these kids unfortunately have like severe syndromes. We don't know what they have. They have certain disease. We're unsure of what it is. And the parents are usually not there because they are left out. So we don't have like a family history. So part of our corporate social responsibility today is to try and provide this service for them from different NGOs or private donors. So currently we're making a fund for it that's going to be run by this NGO to provide these patients, these infants, let's say with the needed genetic testing in order to diagnose them well, to treat them well, to give them a better chance of survival.
Any success stories you can tell us about?
Yes, actually, there is like quite a few success stories. And there is one which is, unfortunately, it is a sad story, but it gave us closure. So I'm going to share two stories with you. One of them, the first one, it is a real success story. So one of our patients came to us with like, she always like has disturbances, abdominal pain, cramps. And everybody was telling her, yes, stop eating this, stop doing that, maybe this is IBS, etc. So she came to us with these vague symptoms. And then we did our genomic tests. And on the genomic test, we had like several ticks, especially on the colon, Crohn, ulcerative colitis. There was like two other ticks. I don't recall the exact disease, but I told her, you know what, we cannot make this. And she was like 40-year-old, so I told her it's not gonna be that easy. We need to do a colonoscopy. Told me, no, my doctor told me at 50 there is no need. I told her, no, we need to do it right now. And then she did her colonoscopy, and fortunately enough, we found like a small patch of ulcerative colitis. That started very early on. Usually they start at a later age, but in her case, it started early. It was just a small patch. We discovered it. We started on her on the treatment, and now she feels much better. So instead of progressing and then getting to a point where there will be bleeding, cancer risk, etc., all the complication, now she's gonna have a better life. She's gonna avoid maybe having a colectomy one day. So this is one of our success story. The other one, unfortunately, it's a sad story. So our geneticists in Jordan, they all had COVID. She, her mother, her father. It was a walk in the park. It was very easy. It was like just a simple flu. So taking that, her brother thought, okay, we have good genes. COVID is easy on us. And then he got COVID. And unfortunately, he went through one hectic pathway for the COVID. In ICU, ECMO, he didn't come out, and unfortunately, he died. So fortunately enough, we took a sample and we sent it for sequencing, and we found out that he had two conditions that made it very tough to survive. Given his 35-year-old, he's a very good built man. So the two conditions were cystic fibrosis and factor V Leiden.
Wow.
So being 35-year-old and cystic fibrosis doesn't make sense, but unfortunately it was an underlying condition. Having factor V Leiden made sense of why he had the IC, coagulation. Cystic fibrosis made sense why his lung wouldn't pick up, etc. So it gives the family closure, it gave us closure why this happened. But unfortunately, if we knew beforehand, maybe it would have been a different approach to treatment. It would be a different approach to prevention, and it would give him a chance, unfortunately. And yeah, that's it.
Thank you for sharing those stories with us, and I really enjoyed our talk. It's good to see someone at the forefront of medical innovation and disruption in the healthcare sector in Lebanon. And I'm really impressed with your determination to focus at prevention at the core of your business. I really resonate with your message. Are there any final words you want to conclude this talk today?
Well, first, I'd like to thank you for this opportunity to talk more about prevention, to spread this awareness. Second, I'd like to invite all the healthcare to take a look on the genomics, take a look on this new science, if you'd like, and patients alike and customer alike, everybody to just be open to the idea, to get to know more, see if you have any risk factor in your family, go and do the test, because there is a lot that we can do. There's a lot of prevention we can do, and it could save your life one day.
Thank you, Kevin. Thank you, MohammadAli, for being on this podcast, and especially thank you, Kevin. I mean, this is a positive story in a dark era in Lebanon right now, but hopefully a lot more people will be doing things like you and starting startups in the country that will create jobs and move the market forward.
Yes, hopefully.
Thank you.